days left of 2020, a year that has felt like a lifetime, but has also taught us a whole lot. Tonight in our coronavirus special, we're answering your questions about all things COVID-19, the vaccine, and how the pandemic is impacting all other parts of our health. But most importantly, how we keep moving forward. We Together, a coronavirus special.
And thank you for joining us tonight for our special. I'm Molly Patt. Tonight I'm joined by two experts in this pandemic from Stormont Vail Health. Dr. Bradley Poole is here from orthopedics and sports medicine, and then Dr. Kevin Dishman, who is the chief medical officer. He is joining us from the Stormont Vail Event Center. So thank you both for being here with us tonight. Now, we do only have 25 minutes here and a lot to get to, so I want to go through a quick update on the latest numbers and trends that we are seeing right this minute. First, so a look at the numbers in Kansas. More than 218,000 people in the state have tested positive since the pandemic started. More than 2,500 people in the state have died from the virus. And right now, over 1,000 people are in the hospital fighting the virus in Kansas. So taking a look at the latest coronavirus headlines now, Novavax says that today is the start of their phase 3 trial of a COVID-19 vaccine. It is the 5th company to launch a large-scale trial of a coronavirus vaccine in the U.S. Plus, more Americans were hospitalized this past week than any other week of the pandemic. And TSA says it screened about 1.28 million people at airports across the country just yesterday. And that's the highest level of air travel since March 15th. In LA, there's an average of 920 flights a day scheduled through January 4th. That's up nearly 100 daily flights since Thanksgiving. So Dr. Dishman, I want to start there. On that note, is there a concern about all of the holiday travel and a potential surge that will overwhelm the hospital from that?
Certainly. Thanks, Molly. Certainly there's a concern about the travel and the exposure that people may have from that travel. We anticipated that with Thanksgiving as well. What we did see was an increase in the total number of cases over time. While we didn't see a dramatic spike immediately following Thanksgiving, what we have seen is sustained community spread. Suspicious that that's from the travel and people getting together during Thanksgiving. It's been really difficult during this time when we haven't been able to be together. It's kind of surreal to be sitting here with you in this building that's been changed into a vaccination center. But these are all things that we're dealing with in this new time of 2020, and I think many people will be happy when this year moves on.
Yeah, just 5 days left of 2020. We're all counting down. Now, we have been asking our viewers to send in questions to ask you guys, and there are dozens about the vaccine, as I'm sure you can imagine. So, Dr. Dishman, I'll start with you. Rachel Daniels wants to know, once the vaccine gets to be more widely distributed, how long until we see the number of cases go down from receiving the vaccine, and how long after getting the shot is it effective for?
So what we know is that with vaccination, we'll see community spread decrease. With the first vaccination, we achieve about a 55 to 85% protection rate for the individual who's been vaccinated. The second shot brings that up to about 95%. So once we see people receive both shots, the Pfizer shot being 21 days apart, the Moderna shot a little shorter than that, we should begin to see community spread decrease and start to see a decrease in the number of cases. The other interesting thing about vaccination is we see the level of intensity of the illness, even if you do get COVID after the vaccination, is shorter span and a decreased level of intensity. So vaccination appears to have protective effects from not getting the virus and making the disease less precocious if you do get it after you've had the vaccination.
And so there's a lot of misinformation out there about the vaccine. Dr. Dishman, can you talk about reactions that people can expect after getting the shot?
Sure. Reactions may be very similar to what people experience when they have a flu vaccine. The majority of reactions are just soreness at the injection site and maybe some mild muscular aches, that sort of thing. Less than 2% of people experience symptoms. And so by and large, the vaccination is well tolerated. And again, these are symptoms we see very similar to what we experience with the flu vaccination.
And Dr. Poole, I didn't forget about you here. So is there anything that people can do at home to help relieve some of that sore arm pain if it's feeling pretty bad once they get the shot?
Oh, sure. That's a good question, Molly. I think that basic over-the-counter anti-inflammatory medications, ice, rest, all things that you can do to help with some of that localized soreness, even in terms of a proactive approach to use that medicine even an hour or two before you go to get your scheduled vaccine. I think that can be helpful for folks.
Okay, Dr. Dishman, another viewer question. Martha Pierce wants to know what procedures are in place for allergic reactions to the vaccine if that does happen.
You bet. The safety of our patients is the first and foremost concern, and that extends to the vaccination clinic here. We have acute treatments ready for people that should have any sort of an allergic reaction. Even an anaphylactic reaction can be treated, and the emergency medical system is available should we have something more serious that needs to be transported to the hospital. What we've been experiencing is the minor reactions that we talked about. People may have not eaten throughout the day. It's important that you remain hydrated before you come to get your vaccination. Eat normally before you come to get your vaccination, and again, make sure that you're drinking water throughout the day and that you're well rested when you come to have the vaccine. We're hopeful that everyone will be able to get the vaccine soon, and want people to understand that we're taking every precaution to ensure that that is a safe and as comfortable as possible process.
All right, Dr. Poole, I want you to talk about how the pandemic has impacted other parts of our health, staying active and conditioning. How have those areas changed over the last 9 months? We know that, people are cooped up, some gyms have had to close, so how has that impacted people?
All right, that's a good point, Molly. I think that it's important for folks to stay active in terms of blood pressure issues, weight issues, all things that can be improved by physical activity. And it's been a real challenge for folks being pent up, like you said, not being able to really get out to formal gym activities. I think even basic things like things you can do with home type exercise, whether you have access to some home gym equipment or even just some body weight resistance exercise, jogging around the neighborhood, things you can do to still maintain social distance and be able to still burn some calories and stay healthy.
And so how is that going to impact us in the long term? Will this year of potentially less activeness have long-term effects? At the start, I felt like everybody was rearing and ready to go, doing what they can, and it's kind of slowly, dropped as all of this drags on.
Oh, right, that's a good point as well. I think that there's a bit of a mental fatigue that comes with this process. After all, I think we started in March with the whole process, so I think that people just get worn down. And I think trying to maintain regular office visits with your physician, trying to stay engaged with friends and family, even if it's just walks around the neighborhood, being out at a ball field, those kind of things I think are still very important. And I think trying to maintain that healthy lifestyle as well as good eating habits, good sleeping habits, I think those are all key to maintaining overall wellness in terms of overall health.
Yeah, and definitely help our mental health as well doing those things. Now, Dr. Dishman, what other long-term effects are being talked about from COVID-19? Robin Gooden is worried about possible long-term side effects 5, 10, 15, 20 years down the line, if any. So obviously we know that it's hard to say because the virus is so new, but is there anything that we know and should be aware of right now?
At this point, it's too early to say exactly what the long-term effects of this vaccine will be. We know that there are effects from the influenza vaccine. We know that there are effects from other vaccines that we take. We know that most of these reactions are minor and not sustained. However, no vaccination is perfectly safe, and so Dr. Poole makes a very good point. It's really important that people who have questions discuss those questions with their primary care provider and ensure that they have all the information they need when they make this decision to take the vaccination.
Dr. Dishman, I want you to talk about what's in the vaccine. Every year when the flu shot comes around, people are concerned that they're going to get the flu from the shot. So can you explain the process of how it protects you, and is the virus in the shot?
Sure. Many of the vaccinations that we've had in the past were live attenuated viruses, meaning they were actual parts of the virus that had been neutralized. This vaccination comes from messenger RNA, which does not alter the DNA of the person taking the vaccination. What it does is it affects the virus's ability to produce the proteins that allow it to get into the cell. So actually, the vaccination allows the body to form a blockade so that the virus cannot actually enter the cell. If it doesn't enter the cell, it can't make us sick. And even if a few small viral particles get by, there's not enough of them to create significant illness. So the real key to this vaccination is not that it is actually the virus itself, but it actually affects the virus in a way that makes it not possible for it to enter the cell, and that's how it works.
Okay, so I've heard an analogy that the vaccine is almost like an email to your body. So you get the vaccine, basically sends an email to your body, says, okay, if you get the virus, this is how you need to react. Is that kind of a good way to dumb it down a little bit?
You know, Molly, I think that's a very good point. I think that's a great way to put it. What this vaccine does is allows your body to recognize very, very quickly that this virus is present, attack that virus, and get rid of it. So it's like sending an email or providing an early warning system for your body so that it recognizes the virus very, very quickly and removes it from your system.
Dr. Poole, you're an orthopedic surgeon, so do you know if the vaccine will be a requirement for people before getting procedures, just like there is that test requirement right now before getting a procedure?
Right. When you look at what we've done at Stormont, Molly, with outpatient surgery, which is mostly what we do in sports medicine, about 4 days prior to any scheduled elective procedure, there's a checklist that patients have to go through with some phone type interviews. And then 3 days before the scheduled procedure, all our patients are COVID tested to be sure that they're not carrying the virus. Then that patient is instructed to self-quarantine for about 3 days, and then they can come safely for their procedure after that window. And then if they've developed any symptoms during that period, no doubt it's important to make everybody aware who's part of your healthcare team.
And do you kind of foresee that being the case for several months, if not years to come?
I think it's a necessity as we get most of our folks the most at risk vaccinated initially. I think that's going to be a process we're going to keep in place. It has been very effective. We've been able to effectively really minimize exposure to staff as well as other patients and family members with this approach. So I think it's going to be with us for the foreseeable future.
And Dr. Dishman, you're at the event center right now. You kind of mentioned this earlier where shots are being given. It's kind of been turned from the event center to this vaccination site. So how is that operation going over there right now? How have things been looking? We know there are empty chairs behind you, so people not there right now, but how has it been going over the last couple weeks?
So this has been a terrific process that the team from Stormont has set up. It moves through very quickly. We have been able to offer it to all of our frontline employees at Stormont Vail, and I know other hospitals and facilities in the area have been doing the same. So we're able to move people through here in efficient fashion, observe them for an appropriate amount of time after the vaccination to ensure that they don't have any reaction, and then provide them with the follow-up that they need to get the second portion of the vaccination. So it's really a terrific process. We have designed this here, and we'll be able to provide this resource should we be called upon by KDHE or the county to do so. That will become part of our mission, and we're ready to accomplish that with this facility here.
All right, great to hear. All right, we're going to take a quick break here, and when we come back, we're going to answer more of your questions, dig a little bit deeper into how the pandemic is impacting overall health and what things are going to look like over the next few weeks. We'll be right back.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vail Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.
So that rash or spot you said I should keep an eye on, it's definitely getting worse.
Okay, let's take a look.
Ew.
There's definitely some swelling. Is it warm to the touch?
Yeah, it's pretty warm.
Okay, well let's try a prescription ointment. Is that a Justin Bieber tattoo?
Okay, gotta go bye.
Stormont Vail now offers virtual care, so you can talk to your doctor almost anywhere. Download the MyChart app to get started today.
We're going to find the perfect tree.
We're going skating.
We're going to Nana's.
Wherever you go this holiday, Chevy can help you get there.
Which is why we're making our Chevy employee discount available to everyone.
The Chevy price you pay is what we pay.
Not a cent more. So wherever you go, happy holidays from Chevy.
Use the Chevy employee discount for everyone to get over $5,200 below MSRP on this Trax.
Get the Chevy employee discount for everyone today.
I know this all looks very Hollywood, but guess what? This is a Nissan sales event ad. Sales event ads are usually boring. Is this boring? There's a nice little present. This Altima has intelligent all-wheel drive, unlike that Accord behind me. What did you want, a big red bow? I mean, who does that?
Welcome back to our coronavirus special discussion. We want to get right back to it. So Dr. Poole, let's talk about how the healthcare system has been overwhelmed through this pandemic. How is that impacting other injuries and people getting the care when it isn't COVID related?
Right, that's a good point, Molly. I think the challenge has been initially what exactly these waves are going to look like in terms of resources, having the ability to still do elective surgery, meaning non-emergent or cases that can be done in a not specific needed fashion. So I think initially for us it was a challenge trying to divvy up those resources in a responsible way. And I think with what we've done now with our hospital system has been able to manage those issues with good efficiency throughout the system, and then being able to take care of those folks who have non-life-threatening type problems. I think the challenge has been folks with these injuries at home recognize that their injuries are still important enough that they should, in terms of overall good outcomes, still seek appropriate medical care to try to get the best quality care and in a timely, responsible fashion.
Yeah, I can't relay that message enough. Don't delay. Get to the hospital if you need to still. Okay, so Dr. Dishman, how is capacity, staff, and equipment looking at the hospital right now? We know some staff were sick for a while, and so that made things get difficult. How is it looking this week?
You know, this week we have noted some return of several employees from quarantine and from being off with COVID illness. So better this week. Encourage people to continue to social distance, continue to wear your mask, and continue to avoid large gatherings. That's what's really going to help slow the community spread until we have an opportunity to get everyone vaccinated. The vaccine is on its way. We know that we'll be receiving additional shipments shortly, and we're in anticipation of getting everybody vaccinated as soon as possible, because that's really what's going to turn the corner on this pandemic. We've experienced, again, a sustained period of our census at the hospital, and hopefully we're not going to see another spike. At this point, we're hanging in there, Molly, and we're able to provide care to everyone that seeks it, and we're working really, really hard with the hospitals in our region to continue to be able to provide care. We continue to provide care for the emergency procedures, as Dr. Poole said, for time-critical diagnoses like heart attacks, strokes, and those illnesses on a continuous basis. And you know, the really big thing that I want our community to be aware of is the monumental effort that the entire staff, no matter what your role is at Stormont Vail, how they're working together to ensure that this community receives uninterrupted health care. The people I work with and for are truly the heroes of this community and the heroes of this pandemic, and the monumental effort that they're putting forth is inspiring.
Yeah, I agree with you on that one. Dr. Poole, there are still some naysayers to this virus and really how serious it is. So what do you say to those people, especially seeing it from your perspective, how it's impacting many other aspects of health as well, even for people who don't have COVID?
Right, I think we all look at our personal experience with what's gone on since spring, and thankfully most of us don't really have personal experience or personal knowledge of a family member or friend who's really had a significant problem with this illness. But I think the challenge is, Molly, when you look and see on a nationwide scale, even healthy young folks have had real issues in terms of significant long-term heart and lung issues, especially in the sports medicine realm. Kids who have had issues trying to regain pre-COVID function. So I think that data, when you look at it, it's real information. And I think while those risks are relatively low for young, healthy people, especially in the sports community at the high school level or even the major college level, still we have to do our diligence to be safe, appropriately distance, wash our hands, wear masks, because those issues, while small percentage-wise, still can be very deleterious long-term in terms of some chronic health issues.
Yeah, keep doing all the things that we've been saying in 2020. All right, we're going to take another quick break here, but we still have more questions to get answered coming up, so we'll be right back.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
Time's running out on the final days to get a great deal at Toyotathon. There. Now you have a little more time.
Get 0% APR for 60 months or $2,000 customer cash on a new Highlander or Highlander Hybrid.
I feel younger.
Toyota, let's go places.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vail Health, empowering you together.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vail Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.
Hey, Mom and Dad, there's a way to let your kids have fun.
And learn a skill that could save their life.
Swim lessons, woo!
Sadly, drowning takes too many young lives, but it's preventable, and studies show that lessons reduce that risk by 88%.
So go to usaswimmingfoundation.org and enroll your child today.
I learned how to swim.
The USA Swimming Foundation, saving lives and building champions.
Time's running out on the final days to get a great deal at Toyotathon. There. Now you have a little more time.
Get 0% APR for 60 months or $2,000 customer cash on a new Highlander or Highlander Hybrid.
I feel younger.
Toyota, let's go places.
All right, we are back for our final segment in tonight's coronavirus special. Dr. Dishman, these next couple of questions are ones that just keep coming up week after week. So first, can people test positive for several weeks or even months after they've recovered from the virus?
Molly, the short answer is yes. Because someone is testing positive doesn't necessarily mean that they're shedding an active amount of the virus to where they're acutely infectious. Some people can carry that longer. So by testing positive, we hope to correlate that with a history which shows that that was a recent infection. There are individuals who can test positive for an extended period of time, and again, those are things that we're just learning about this virus now and understanding how all of that communication occurs. So the short answer is yes, you can test positive for the virus for an extended period of time.
So if you've had COVID-19, should you still get the vaccine, or should you wait and kind of let people go ahead of you until your immunity time is up?
Even if you've had the coronavirus at this time, should still go ahead and receive the vaccine as long as you're not having active symptoms, as long as you don't have a fever or any of the other symptoms that you're going to be asked about when you come here for the vaccine.
And then when you get the vaccine, can you still be a carrier and pass the virus along even though you're vaccinated and somebody next to you may not be? Can you still carry that and transmit it to them?
So at this point, what we understand is that once you've passed that threshold of 7 days since your last fever, the amount of virus that you're passing to other people should be very diminished to the point where it shouldn't really be a significant risk to other people around you. It's really the whole point for the quarantine process and for the CDC recommendations of how long one should stay quarantined after an active case.
Okay, Dr. Poole, I want to talk about those involved in sports here. A lot of people get their exercise, both young kids and adults, from playing sports and being active in groups. Now, when those things start to come back, is there anything that you recommend to people that they can do to enjoy that group setting again, but also keep safe with each other?
Right. I think the hard thing is when you look at sports, by definition, probably hard to really be active in a group wearing a mask. So I think to socially distance in a sport like basketball, I think some exercise is more readily performed with maintaining some of these parameters we've been paying attention to for the last several months. But I think that individual type exercise, running, weightlifting, even in some of our gyms around town that are open now, I think that folks can still maintain a relatively safe distance and still be able to get weight training in. Cardiovascular function can be improved with other basic, relatively individual outdoor type exercise. But in the team setting, I think that's a bit more of a challenge, and I think it may still be a bit of time before even some of our indoor sports can be more normally performed with fans and friends attending.
And have you had any patients who have had COVID and have had a really hard time just getting back into the swing of things physically? Obviously, it can put you out for weeks, if not months, and obviously that makes things difficult to stay in shape. So what can people do to just get back into it safely?
Right. I think that we try to really just gradually return our college athletes as well as our high school athletes in a regular gradation type program. I think that we try to increase distance, time of events or activities of about 10 to 15% a week. And then as patients are able to overcome their deficiencies, able to move to the higher level of function. So I think that graduated type of return is most ideal. And then I think importantly, athletes really have to pay attention to their body and symptoms. And as long as you're able to achieve certain goals, I think that from that standpoint, it's then safe to move to that next phase.
Okay, Dr. Dishman, I want to go back to something that you said a little bit earlier. You talked about how you guys are getting another shipment of vaccines. A lot of people are wondering when they will know it's their turn to come get vaccinated, the mass vaccinations. The next shipment, is that, for the second dose for healthcare workers who have already been vaccinated, or is that next shipment for the second group of people that are going to get the vaccine?
Well, what we understand is that that there is another shipment. The shipment for the second vaccine for the people that have already received their first vaccination has been secured and is being transported, we understand. So what we're really waiting on right now is determination from KDHE and the county on when to move forward and who gets the vaccine next. That decision should be coming shortly, and we'll be utilizing this facility to provide up to 1,000 vaccinations a day.
Wow, that's good news there. So at first, Dr. Dishman, it was said that the virus was spreading through droplets and on surfaces. Is that still the case, or do we know now that it is airborne as well?
So really what we know is that as you said, it is passed through droplet, through contact. There are procedures that people undergo in the hospital that are aerosol generating, like a bronchoscopy or anything that tends to produce significant airflow from the lungs. But for the majority of the time, particularly outside of a procedure room where we would do that sort of procedure, it's strictly droplet. And so wearing a mask, washing our hands, social distancing is extremely important to stop the spread of the virus and will provide a significant amount of protection.
All right, Dr. Dishman, in one sentence, if you want anybody to take one thing away tonight, what would it be?
That this pandemic will end and that vaccination clinics such as this one are going to be a big part of that.
All right, Dr. Poole, how about you? One sentence that you want people to take away from tonight.
Sure. I think getting back to life. I think that, like Dr. Dishman said, we're close. I think the vaccine has been such a groundbreaking type achievement in terms of what the science community has been able to do in a relatively short period of time. So I think that for everybody to know that we're rounding the corner and to still stay positive and do what we can to keep everybody safe.
All right, yes, there is hope on the way, and it is already here too. All right, thank you both so much for joining us for this coronavirus special, and thank you for watching tonight. If you still have a question, just email them to coronavirus@ksnt.com. Have a good night.
So that rash or spot you said I should keep an eye on, it's definitely getting worse.
Okay, let's take a look.
Ew.
There's definitely some swelling. Is it warm to the touch?
Yeah, it's pretty warm.
Okay, well let's try a prescription ointment. Is that a Justin Bieber tattoo?
Okay, gotta go bye.
Stormont Vail now offers virtual care, so you can talk to your doctor almost anywhere. Download the MyChart app to get started today.